Well, this morning we are talking about protecting the largest organ of the body, the skin. And what better time to do that than during the month of May, Melanoma Awareness Month. Studies show melanoma kills 7,000 people a year, but the disease is preventable. Dermatologist Dr. Pare joins us now with more on preventing skin cancer through sun protection. Good morning, Dr. Pare. Thank you so much for joining us.
Good morning. Thank you so much for having me.
It's a pleasure. Let's dive right into it. So tell us more about what melanoma is and the risk factors associated with this particular disease.
Well, we are always so grateful that this month of the year we're paying higher attention to skin cancer altogether. Melanoma represents only 4% of all skin cancer, but it is the one that's most lethal, and 75% cases ultimately become metastasized. But we do talk to patients about the cancer of the melanocyte, which is a pigment-producing cell, as well as the keratinocytes, the basal cell and squamous cell carcinomas. They are so common. Some of them are genetically predetermined, but many of them are sun exposure induced. So that's why we do like to talk about prevention, particularly with this beautiful weather coming up.
What are some of the things that people should look for on their skin? Is it necessary for adults to actually get an annual skin exam to actually see what's going on in their skin?
Absolutely. So one of the goals of the Melanoma Awareness Month is to make it clear to all patients, regardless of race, regardless whether they're female or male patients, to come and see us at least annually. Of course, that frequency is determined by your familial history, where you grew up, how many sunburns you've had, how fair or how darker complected you are. But truly, everybody needs at least once a year skin check when you're seen by a dermatologist and really looked over from top to bottom. And that is one of those elements that we talk as one of those really important factors that help in prevention. And during these visits, we do teach patients about the typical 5 parameters that we talk about: the changing pigment, the changing border, the changing size, the newly acquired lesion that needs to be evaluated. We have made a pledge to all of our patients. We sent everybody with a little card as the ABCDEs of evaluating them all, and we're challenging everybody to tell the loved one or friend, family, to come and see us for a skin check that we suggest.
And Dr. Pare, because it's so beautiful outside, the sun is shining, should we be wearing sunscreens while outdoors? And if so, what should the SPF be? Do we need to keep it at a high level?
Well, I think sun protection has really expanded over the last several years. Of course, we still focus on sunblocks, and that typically we will tell patients to at least reach for SPF 30. And those are come in many different vehicles and lotions and sticks and creams. As long as those are reapplied every 2 hours when you're outside, they really can serve as beautifully protective topicals. Nowadays, we also recommend oral supplements that can help with improving sun protection. We talk about head and clothing that have SPF built in, and those are so incredibly helpful and nowadays quite easily available. So avoiding the exposure outside of the highest sun exposure time of the day between 10 and 2, wearing your sun protection in the form of a sunblock, lotion, cream, spray, reapplied every few hours, as well as wearing hats and sun protective clothing, really will contribute to minimizing the exposure, and therefore resulting in sunburns, and therefore resulting in potential precancerous spots or even ultimately skin cancer.
And doctor, really quickly, what about people of color? Should they wear sunscreen?
Absolutely. And this is, as I've started my conversation, I think it's so important for all of us to get skin checks, and for all of us to wear sunblocks. I think that we are all at risk, and although it's probably much less frequently than in patients that are of lighter color, we all potentially can develop skin cancer, and it's not infrequent that in patients of color that cancer may show up in less typical areas, and therefore requires a professional eye during an exam.
Doctor, thank you so much for joining us and providing us with that information that could save a life. We really appreciate it.
Thank you so much, and I appreciate being included. Please check out on dermatologyconsultants.org. We have lots of information, and our weekly coffee chats now focus on melanoma awareness. So I really appreciate this. Thank you.
You're welcome. And once again, for more information on today's segment and Dr. Pare, head over to our website, fox5atlanta.com, and click the Seen on TV tab.